po, Doc.
Okay, sige. So, Dr. Ponce, okay, let's start na, no? Okay. Okay, for today, we are going to discuss about the main internal genital organs, or it's just a topic that is more inclined towards the main pelvic cavity organs, as well as it is a more detailed explanation on what Dr. Mike Capulong's lecture from the last week topic, no? So, let's begin. Okay, for my intended learning, we are to describe the structures or the organs that's found in the pelvic cavity of the male. And we are also to discuss the common clinical conditions that we usually see during our clinics. And let's correlate it with the anatomy and what are the structures that we see in the cavity area of the male. Okay. Okay, this is just an overview on what we are going to discuss. Okay, so for today, for the main internal organs, we're going to discuss about the vas deferens, your seminal vesicle, ejaculatory duct, the prostate, the prostatic urethra, as well as the membranous part of it, the testis, and the epididymis. Okay, so for the vas deferens, it is important to take note that as your epididymis tapers to become the tail of the epididymis, that tail of epididymis, okay, is continuous, it's going to be continuous to become now your vas deferens. Your vas deferens is also known as your ductus deferens, so don't get confused about it. And it travels towards the spermatic cord, enters the pelvic cavity, travels towards your gallbladder, eventually tapers down to become your ejaculatory duct, pierces the posterior aspect of your prostate, and down the line to your urethra. Okay? So for the seminal vesicle, it's important to take note its close relationship posteriorly to the rectal bulb. And later we'll be discussing the seminal vesicle will be joined by your vas deferens as it tapers in unison to become your ejaculatory duct. Okay, as you can see here, the ejaculatory duct pierces toward pierces the posterior aspect of the prostate, and that that pathway that it pierces will now become your prostatic urethra. A portion, this one, from the name itself, the urethra that is being seen within the prostate is the prostatic urethra, and just below it, it will now become your membranous urethra. We are also to discuss about the testis and the epididymis. And take note, the discussion of your testis and epididymis will not be very detailed. I'm sure it was discussed in your microscopic anatomy as well as physiology for the hormonal aspect, which I think this is my last slide. Just kidding, Dr. Ponce. Okay. In detail, this is a picture showing to you the cadaveric specimen of a male. So you can see here, you may be confused because most of the structures are already dehydrated because syempre for preservation. If you put up picture as it was described earlier. Okay. So important to know, it's really to correlate what you see in your atlas as well as to your cadaver. No? Okay, we'll be discussing most of the structures and what are the structures in correlation with which, for example, for the prostate. Okay, so let me know if I'm going too fast, Dr. Afonso, para and also makasabay lahat. No? Okay, so your vas deferens or your ductus deferens, it is a thick walled tube. Again, as we've said earlier, it is about 18 inches in long. The main function of which is to convey the mature sperm. As we said earlier, as the seminiferous tubules that are going to produce your sperm will travel towards the duct of the epididymis, and that duct of the epididymis will taper down to the tail of epididymis, and that tail of epididymis will be continuous to your vas deferens or ductus deferens for the sperm to travel from the testis down the line for expulsion. Okay. Your vas deferens also emerges from the deep inguinal ring. Okay. Just a review. Um, What structure again produces the sperm? Anyone can answer. Sorry, I can't see it can only remember the thoraconcer. The thoraconcer, what structure produces the sperm inside the testis? Kaya yan. I just said it earlier. You can ask, anyone could help. Okay. Seminal vesicle, actually it's your seminiferous tubules. Okay. So later on we'll be discussing as well as some cells that will be producing the hormones for the male um, pelvic cavity organs. Okay. So again, take note of which the seminiferous tubules will be producing the sperm. It may come out during your examination. Okay. Okay. So that's your vas deferens or locus deferens. Okay, since we are studying anatomy, it's very important to know the structures that is being correlated or in relation to what we are trying to drive at. Okay, for this one, your vas deferens would pass around the lateral margin of your inferior epigastric artery. But for this slide, it is also important to take note the ischial spine. Later on, we'll be discussing on how your vas deferens will travel towards the bladder and it goes posteriorly. Okay, just take note of this ischial spine. Okay, so having that said, your vas deferens or ductus deferens will now travel downward, backward, on the lateral wall of the pelvis, and it crosses, take note of this structure, it crosses the ureter at the level of the ischial spine. So if we are closely going to correlate it with the picture or the diagram previously shown, exactly at this portion, the iliac as the at the level of your ischial spine, the vas deferens continues posteriorly will now be crossing over the ureter. Okay, take note of it, Shab. Okay. As it crosses as it crosses the ureter, it now passes medially and downward towards the posterior surface of the bladder. Okay? Just to orient yourself, the picture here is the paramedian or sagittal section. So for the male pelvic organ, it is being cut in equal halves. So naka-side view lang siya. So just to remember in the anatomical position, no, for you to better appreciate something, for example, the action of the biceps, it has to be in a side view, no, or sagittal view. So same as for this one, same application for us to further see or how the vas deferens travels towards the pelvic cavity. We also would want to see it in a parasagittal view or a paramedian view. Okay. Just to remind you, in studying your gross B, I think for me, it is a bit easier compared to your gross A. Majority of the structures in your gross B are visibly large, so you could appreciate it in comparison with your gross A. Some of the structures is really hard to appreciate, most of which are the muscles of the intrinsic hand and the forearm musculature, as well as the muscles of the leg and the foot. So in correlation with gross B, the structures are very visible or very big, and the arteries or the lymphatic drainage as well as the veins are in close correlation on the vessels that are going to be seen within also the cavity area. So you won't be confused. Okay, so let's move on. Okay, so your ductus or vas deferens, okay, important to take note. No, I have to orient you again. The picture above here as well as below, it's the posterior view. So for example, I'm standing up and the examiner, you as a student, you're facing at the back posteriorly. So if we try to remove the structures, your paralumbars, your spinal cord, as well as your vertebral bodies, you could appreciate or see the bladder in the form that is being depicted to you. Okay, so just to orient you, this is your urinary bladder. Your ductus deferens or your vas deferens crosses your ureter at the level of what? Okay, para consel. Sorry, ikaw lang yung maalala ko. Just a review. It crosses the ureter at the level of what? Anyone
Ischial
can answer?
spine po.
Okay, ischial spine. Very good, no? So take note of that. Okay, as it crosses your ductus or your vas deferens towards its terminal portion, it dilates to become the ampulla of your vas deferens. And later on, it will now be joined by your seminal vesicle to become your ejaculatory duct. No? So meron in unison, magkakaroon sila ng union. Okay? The ejaculatory duct now pierces the posterior aspect of the prostate, as you can see here. No? Okay, so sabi dito, the terminal part of your vas deferens is dilated, this one, to form the ampulla of the vas deferens. Okay, you have to take note that the ampulla or the vas deferens, it is two or paired, no? You can see it on the left side as well as the right side, same as your seminal vesicle as well as your ejaculatory duct. Okay, if we further cut the posterior view or the bladder in its posterior view, coronal section, we could now appreciate what I am trying to drive at. As the vas deferens terminates to become the ampulla of the vas deferens, there there will be a union from the seminal vesicle of the ampulla of the vas deferens to now become the ejaculatory duct as it pierces the prostate posteriorly. Okay, so take note. Okay, so far so good, or am I being very fast?
Dok, pwede po ulit po yung last na sinabi niya.
Okay, sige.
Sorry.
Ayan. No worries. It's okay. Okay, it is important to take note as your vas deferens travels, diba, it will be coming, the first part of which will be coming at the tail of the epididymis. So it travels to pass through the spermatic cord, down the line to the urinary bladder. Okay, so as it travels very near to the ischial spine, it will now be crossing over to the ureter. Okay, so then this ductus or the vas deferens, before it terminates to its terminal portion, magkakaroon muna siya ng dilation. Okay, so that dilated portion, before it terminates toward your prostate, magkakaroon ng union, yung ampulla of vas deferens and your seminal vesicle. That union tapers to become the ejaculatory duct. Okay? As you can see here in the picture, no? Ayan. So your vas deferens, as it dilates to become the ampulla, okay, it will now be joined by your seminal vesicle to become your ejaculatory duct. Parang nagiging funnel siya and it pierces towards the prostate. Okay? So posteriorly siya. Okay? So take note, it is paired. What you can see on the left, you could also see on the right. And later on, as the ejaculatory duct pierces the prostate, we are now going to correlate it with the prostatic ventricle. So the openings, the left and right openings, very near to the prostatic ventricle, it is still your ejaculatory duct. Okay, I'll be showing it in the next few slides. So don't worry. If you have questions, just let me know. You could interrupt. You could interrupt me, no? The lecture is quite short lang naman. So if you have questions, feel free to do so. Okay. Is it clear na? Okay naman?
Yes po, Dok.
Sorry, no? So going on, as part of the accessory sex gland, marami naman sila and we are going to discuss it individually. Okay, so just in continuation to your vas deferens, your seminal vesicle, again, it's two lobulated organs, about 2 inches long. So as you can see here, it is lateral to the seminal vesicle, most notably the ampulla of the vas deferens. Sorry, no, it's lateral to the ampulla of the vas deferens. No? So this is your seminal vesicle, which is present on each side. Okay. The terminal part of the vas deferens lays on the middle side of each vesicle. So take note that your ampulla of the vas deferens is medial in relation to the seminal vesicle. Okay. So having that said, earlier we've discussed as the ampulla terminates, so as the seminal vesicle, it will now be in unison. So didikit sila and will now form your ejaculatory duct as it pierces your prostate. Here in the picture, parasagittal view or sagittal, as you could appreciate, okay, this is your seminal vesicle. No? So it's lateral, ang median na Syempre yung vas deferens, okay? So as you can see here, the ejaculatory duct, this one, it pierces the prostate. Okay, so later on, sa coronal view, we'll be showing the close relationship of the openings of the ejaculatory duct towards the prostatic ventricle. Okay, so it is also important to take note, posteriorly, the seminal vesicle is related to the rectum. Okay, we are also going to discuss kung ano yung tawag sa fascia or yung septum na nagsa-separate sa kanila. Okay? So again, to take note here lang naman is that when your vas deferens and seminal vesicle terminates, magkakaroon sila ng union, and that union will now be your ejaculatory duct, as you can see here. Okay? This one, this is your ejaculatory duct. Okay? So the seminal vesicle as well as the ampulla of bladder lies on the base of the bladder. Okay? So this one also don't be confused. Naming the arteries that will supply some structures within the pelvic area. It's quite easy. Okay, important to take note. Majority of them are named kung ano yung artery na ano yung structure na sinusupply nila. No? So for the seminal vesicle, it is being supplied by your inferior vesicle as well as your middle rectal artery. So this one. Okay. So if I ask during the examination, where your inferior vesicle as well as your middle rectal artery will be coming from what branch? So this one. Anyone can answer? Anyone? Dr. Aponce? Sige.
Iliolumbar. Iliolumbar.
I'm sorry, come again?
Iliolumbar po ba yun?
It's quite near. Okay, it's actually your internal iliac artery. So this one, this is your internal iliac artery. So don't be confused. Kung may choices doon na external iliac or common iliac artery, your answer will be your internal iliac artery. Siya kasi yung mas closest. Although your common iliac could also be right, pero the best answer would be your internal iliac artery. Okay? So again, your internal iliac artery will give terminal branches to become your inferior vesicle as well as your middle rectal artery that will now be supplying your seminal vesicle. And from the name itself, it drains towards the internal iliac veins. So don't be confused. Important to take note lang for this type is the internal iliac artery as well as this inferior vesicle and middle rectal artery. Later on, you'd appreciate majority of the structures will be really supplied by your internal iliac artery and its terminal branches. Okay, so for the function of seminal vesicle, it secretes an alkaline viscous fluid that would contain fructose. This fructose will be used by the sperm as an energy for transport. It also contains your prostaglandin and clotting proteins that are different from those in the blood. And the contents of your seminal vesicle will also help nourish the spermatozoa. Okay. Okay. We now go on to the ejaculatory duct. So your ejaculatory duct, one lang siya, no? Sorry, it's two for left and right. It is at least an inch long. So this is now your ejaculatory duct. Okay. So what happens? The picture below depicts to you the sagittal view. So ginawa lang natin this view posteriorly. So nakaganyan siya. We now orient it in a side view manner. Inikot lang natin ganyan. So you could appreciate the piercing of the ejaculatory duct towards the prostate. Okay. So again, as we've said earlier, it is formed by the union of your vas deferens and the duct of the seminal vesicle. So as it tapers, para siya nagiging funnel, it will now become your ejaculatory duct. Okay? So it pierces the posterior surface of the prostate and opens in the prostatic part of the urethra. So as it pierces the prostate, okay, in this picture you could not imagine it paano kasi it's the side view. So this is also your opening of the ejaculatory duct in reference to the prostatic ventricle. We'll be showing it later on. Okay. So the function of which is to drain the seminal vesicle into the prostatic urethra. Okay? So yung contents ng seminal vesicle, it drains. Okay? Ito na siya. Okay? Whatever is inside your seminal vesicle as well as the as well as your vas deferens, okay? Syempre, it would be uh, containing the sperm as well as the secretory materials from your seminal vesicle, both of which will be drained from the ejaculatory duct towards the prostatic urethra. Okay, so again, no, I have to mention that it has a very close significance to the prostatic urethra. I'll be showing it later. Okay, we now proceed for the prostate. Very important to take note for the next few slides. Ang important kasi for the prostate, we have to know that it has different lobes, and for the specific lobe, it will also have its clinical significance. For example, we are going to discuss later on what specific lobe would render to become prone to cancer, or what specific lobe would render to become enlarged or to be the usual cause of your benign prostatic hyperplasia. So you really have to take note of the different lobes and also its correlation. So for the prostate, what will you find superior to it? What will you find anterior to it? What will you find posterior to it, inferior, and lateral to it? I'll be discussing it. So okay lang naman. Just listen and take down notes. So it's a fibromuscular glandular organ surrounds the prostatic urethra. So don't be confused. Prostate is only one, single lang siya. It's different from the testis. Ha? So some of the students kasi medyo nalilito. May interchange na yung testis from the prostate. Okay? It is only one. Okay? So it has been said that the usual length of which is 1.25 inches in long. Okay? And it lies between the neck of the bladder above and the urogenital diaphragm below. Your prostate is somewhat conical in shape, okay, as you could appreciate in the sagittal view. It has its base, okay, and it has its apex. Important to take note, there is a close proximity or close relationship between the base of the neck of the bladder and the base of the prostate, and also the apex of which, or the inferior part, has its close significance to your urogenital diaphragm. Okay? There will also be a fibrous capsule that surrounds the prostate. So far, so good. Okay naman?
Yes
Just
po.
let me know. Just let me know lang if I'm going too fast or if you have questions. Ayan, okay. So later on, we'll be discussing this one. So again, the prostate is somewhat conical in shape. So for the sagittal view, ayan, it's a bit cone. Okay. Cone or apa in Tagalog. Okay. Coronal view. Ayan, okay. So having that said, its base right here lies against the bladder neck. Okay. And the apex, which lies against the urogenital diaphragm below. So yun yung importance lang naman ng slide na to. It has its it has its base, which will be having a close proximity towards the bladder neck, and its inferior aspect, or the apex, close proximity towards the urogenital diaphragm. And your prostatic utricle, later it has an analog in reference to the female, and this is what I'm trying to drive at. There would be an opening of the ejaculatory duct just inferior to it. As you can see, side view, again, seminal vesicle, ampulla of vas deferens tapers to your ejaculatory duct, side view to. And if you could transition it to the frontal view, tapos meron coronal cut, ito na siya, ejaculatory duct, opening of which. So there would be two, since your ejaculatory duct as well as seminal vesicle and vas deferens are present on the left and right. It will now taper to become your ejaculatory duct, and that ejaculatory duct will have its opening. Ito na siya. Okay, so it's present on left and right. Okay, so this is your prostatic urethra. Okay, yeah. So we are now going to move to the different lobes of the prostate. So the prostate is being divided into five lobes. It has its clinical significance. Okay. This view is actually just the same for this one. Okay. Sagittal cut. So you could appreciate the prostatic urethra also and the ejaculatory duct. Okay. So let's focus on the picture on the right hand side. So this is your anterior lobe, this is your middle lobe, and this is your posterior lobe. Yung coronal cut, okay, you try to have it separated. You could appreciate the two lateral lobes, which is left as well as the right. We are going to have to put a great emphasis on the median lobe as well as the posterior lobe. Okay, so why is that so? So we'll be discussing each and every one. Take note of this slide. This is very important. Okay. So the anterior lobe or the isthmus, it lies in front of the urethra, prostatic urethra. Okay, and it's devoid of glandular substance. Okay. Just to give you a tip, in studying all of these forms or paragraph form, you really have to have your netter or your atlases with you side by side. The paragraph form are just a translation on what you can see on the slides, on the atlases, no? Ginawa lang siya in the form of text, so you could greatly appreciate its location. So, for example, I'll just guide you through this one. Anterior lobe. So, this is the anterior lobe of the prostate. Sabi dito, it lies in front of the urethra. So, this is your urethra, prostatic urethra, right in front of which is your anterior lobe. And later on, the structure anterior to the prostate naman is your pubic symphysis. So this is how you are going to attack on how to study also your anatomy. It's really just looking at the pictures and correlating it with the text that is being presented to you. Okay? So for the anterior lobe, yun yung clinical significance niya. It's right in front of the urethra, specifically the prostatic portion of the urethra. Okay, so this middle lobe or median lobe has its clinical significance. So take note, important to take note. The middle lobe lies between the urethra. So this is the urethra. This is the ejaculatory duct. The structure between it is the median or middle lobe. And that median or middle lobe is prone to benign prostatic hyperplasia for male greater than 50 years old, which will be having symptoms of lower urinary tract, such as dribbling, such as urgency, gustong ihi ng ihi, or may times na fullness of bladder that patients will relate, Doc, I think I cannot fully void, parang may naiiwan pa, no? What happens of which we'll be discussing later is that your median lobe, if it enlarges anteriorly, it will now block certain part of the bladder, and there would be a stagnation of urine. And that stagnation of urine, some of which will not be completely voided, and kung merong nagdi-drip, that would give a sensation of feeling of urinating pero walang lalabas, no? So it's a reflex form of the advance that happens, and it shows to you the lower urinary tract symptoms of the male. Okay, so later on we'll be discussing. So posterior lobe, okay, from the name itself, okay, it is found posteriorly. So take note also during the digital rectal examination, the examining finger, which is gloved and lubricated, if we try to insert it at the rectal vault, okay, for example, the pointer here is the examining finger. As you try to palpate anterior to the rectum, you will now appreciate the posterior lobe of the prostate. And this posterior lobe of the prostate is prone to cancer transformation. Okay? Okay? So just a review, don't get confused. The middle lobe is more prone to benign prostatic hyperplasia or gland enlargement. The posterior lobe, which is found very near in close proximity to the rectum, it will now be prone to cancer transformation. So take note of this. It may come out during your examination. And for the lateral lobes, it's just situated from either side of the prostatic urethra, okay, as described earlier. So this is just the lateral lobe, and majority of the glandular mass is formed by the lateral lobe. Okay, so far so good. Okay, again, Dr. Ponce, if I ask you during the examination, uh, this specific lobe of the prostate is more prone to prostatic enlargement. So what would be your answer?
Middle po.
Okay, very good. This specific lobe of the prostate is being appreciated when you access it during the digital rectal examination and you try to palpate anteriorly, and this lobe is more prone to cancer transformation. So what will be your answer?
Posterior.
Okay, so very good. Take note that it may come out during our examinations. Okay, so we're not just going to correlate it or just divide the lobe into five. No, we also would want to correlate it, the prostate itself, on what structures you could find superior to it, okay, inferior to it, anterior, posterior, and lateral, no? So, ganun naman din siya. Okay? So, for the posterior part, for the superior part, we are to discuss this individually. So, superiorly, it is, it is actually just the base of the prostate, and that base of the prostate would have a very close relationship to the neck of the bladder. So, dyan siya. And the urethra enters the prostate sa center. Okay? So bladder, as it drains, it will now become your urethra. Specifically, if it's at the level of the prostate, from the name itself, prostatic urethra, as it tapers, it will become your membranous down the line to the pendulous. No? So urethra enters the center of the base of the prostate. Important lang, superiorly, okay, base of the prostate, close relationship with the neck of the bladder. Okay, so this one, inferiorly, also known as the apex, again conical, tip, semi conical in shape, base. Okay, you could appreciate the neck of the bladder. Its apex inferiorly, it has its close relationship with the urogenital diaphragm. Okay, yun yung mga structures na you have to take note of this slide. No? So the apex lies on the upper surface of the urogenital diaphragm, and then it will now be transitioning towards your membranous urethra. Okay, so urethra leaves the prostate just above the apex on the anterior surface. Okay, take note. Okay, we now discuss what will be the structures present anterior to it. So from the name itself, again, you really have to make use of your atlases. Okay, anterior to the prostate as a whole, okay, anterior to it, you would be appreciating the pubic symphysis. Middle to it, or kung ano yung sa sandwich, it's extraperitoneal fat in the retropubic space, or what we call the cave of Zeus. Okay, so again, the texts are just mere description of what you can see in the picture. So I really highly encourage everyone to make use of the atlas during studying period. No? And if you try to read your textbooks, meron doon sinasabi, this diagram, kumari 1.8, and huwag kayong tama rin to really go back and scan for it, because you would really appreciate on what is being described if you go back to the pictures or the diagrams that are being asked for you to go back onto. Okay? So connected to the posterior aspect of the pubic bone, it is via your puboprostatic ligaments. So again, just to emphasize, the structure being present anterior to the prostate is your pubic symphysis. It will your extraperitoneal fat is in between, and that space is what we call the cave of Zeus. Okay, so don't get confused. No, so basta anterior to it. If I ask during the examination, anterior to the prostate, your answer would be pubic symphysis. Pero if I ask specifically, it is separated by the extraperitoneal fat in the retropubic space, or the cave of Zeus. Okay. So don't get confused. Take note of this slide also. Okay. So we now proceed posteriorly naman. So this is what we are trying to drive at earlier. No? If during the digital rectal examination, if the examining physician inserts the examining finger towards the anal canal, and he or she tries to palpate anteriorly, your the posterior lobe of the prostate is being appreciated, and it is just being separated by the rectovesical septum or the fascia of the non-piliers. So it is just a very thin fascia. So that's why when performing your physical examination, you could now appreciate the characteristics of the prostate. Some of which, during the clinics, if you try to do the examination, usually, if there would be symptoms of cancer transformation, the posterior lobe will not be very smooth in character. Meron na siyang parang corrugations. You could actually appreciate it during the examination. And there would be added tightness if that also enlarges to become cancer in nature. So you could appreciate it very much in the clinical setting. Right? So again, posteriorly, the prostate, okay, is closely related to the anterior surface of the rectal ampulla, and it is just separated by the rectovesical septum or the fascia of the non-biliars. So it's just this one. Okay, so relations lateral naman, lateral to the prostate, it is the anterior fibers of the levator ani. Okay, so again, in studying the pelvic cavity organs of the male, very important in prostate, its lobes, and the correlation of which of the structure and what you can see above it, below, anterior, posterior, as well as lateral. Okay. Okay, we now proceed to the prostatic urethra, this one. Okay, so the prostatic urethra is at least 1.25 inches in length. Okay, it begins at the bladder neck. Okay, and it terminates at the level of the urogenital diaphragm to become your membranous portion. Important to take note for this slide is among the specific part of the urethra, it's the widest and most dilatable portion of the entire urethra. So for the parts of the urethra, you have your prostatic, you have the membranous, the bulbous, as well as the pendulous portion. No? So during the examination, if I ask the specific part of the urethra, it is considered to be the most widest, and the widest as well as the most dilatable portion. Your answer would be the prostatic urethra, not the pendulous, not the bulbous, and definitely not the membranous part of the urethra. So as it passes through the prostate, from the base, again, the base is closely correlated with the neck of the bladder, to the apex inferior, urogenital diaphragm, where it becomes continuous with the membranous part of the urethra. So this is now your membranous part. Prostatic, membranous. Okay, so take note of this slide. It's the widest and most dilatable portion, prostatic urethra. Okay, so sorry kung makulit, no, but this slide shows to you the different structures you could appreciate within the prostatic urethra. You have your urethral crest. It is just a longitudinal ridge. So ito siya. Okay. So very important, take note of this one. The prostatic utricle is the analog of the uterus and vagina for the females. So this is the prostatic utricle. Inferior to it, the openings you could appreciate is the opening of the ejaculatory duct. Okay. Take note, utricle. It's the analog for the uterus and the vagina in the females. It may come out during the examination. Okay, so for the function of the prostate, it produces thin, milky fluid that would contain citric acid, acid phosphatase, and that secretion would help to form an alkaline environment to help neutralize the acidity of the vagina. So if there would not be alkaline environment, the possibility of fertilization goes down. So it has to neutralize the acidity of the vaginal wall to further facilitate fertilization of the ovum. Okay? Okay, for the blood supply, hindi naman tayo very OC about this one. So from the name itself, you could really remember it. Just remember internal ilia, and the branches would be inferior vesicle as well as your middle rectal. And that vessels will now be supplying your prostate. Okay? So the veins form the venous plexus between the capsule of the prostate and the fibrous sheath. To where it drains, the lymphatic drainage, from the name itself, ulit, no? Structure very near to it, kung ano yung artery, yun din yung sa lymph nodes, no? So, internal iliac nodes, and it's supplied, it's the inferior hypogastric plexus. It's responsible for the sympathetic nerve that would stimulate smooth muscle of the prostate during the ejaculation. Important lang for the uh, nervous as well as for the vascular supply. It's really just remember the internal iliac, so you won't get confused. No, for the examination, kasi you could just throw in their common iliac, external iliac, abdominal aorta. So just remember lang yung internal iliac. You'll be guided. Okay. So clinical correlation. Ayan. Okay. For the prostatic examination, as you can see here, the examining physician inserts the examining finger towards the rectal wall. He or she will now palpate anterior to it. And again, Dr. Alfonso, what separates the ampulla of the rectum towards the prostate? Ano yung fascia na yun? Yung na-mention natin kanina.
Vesical septum.
Okay, or your denominators, no? So yun yung clinical importance. It's very thin lang, so you can appreciate the prostate's posterior lobe. If you try to insert the examining finger and try to palpate anteriorly. Okay. We also have the so-called prostatic specific antigen. Okay. There would be a trace amount of proteins produced by specifically by the prostatic epithelial cells that is present in the peripheral blood. So in certain prostatic diseases, notably the cancer of the prostate, this protein appears in the blood in increased amounts. So if you are actually entertaining prostatic malignancy, aside from doing your physical examination, you could actually request for the prostate-specific antigen. If the levels are very high, since if it represents the epithelial cells of the prostate, it could actually point towards your differential. So baka malignancy na ang kinoconsider natin for your patient. No? So for examining your patient, on top of doing your physical exam, which is very, very important, you could further supplement it by adding specific tests for malignancy. So again, ang important lang naman dito, the posterior lobe of the prostate could be appreciated when doing your digital rectal examination. Okay? Okay, so the importance, okay? Again, what lobe is more prone to benign prostatic hyperplasia? This lobe.
Middle.
So, very good, no? So middle lobe is benign. It's the lobe. It's more common for the enlargement. So usually for males greater than 50 years and older, so the median lobe enlarges, and that enlargement, as you can see in this picture, would be hindering the total voiding of the urine. During that time, if there would be a stasis of the urine, since we all know internal organs would contain different form of bacteria, so it could now further, the bad bacteria could further proliferate, could actually cause your inflammation or infection. No? So if there would be a stagnant urine, secondary to the enlargement of the median lobe of the prostate, furthermore, it could, aside from causing possible cause of your cystitis, this would actually be the cause of the lower urinary tract symptoms, such as your frequency. Okay, for times if this urine spills and is not being completely voided, it actually serves as a reflex. Yung feeling of urgency. So that's actually your lower urinary tract symptoms. That explains usually, no? So just important to take note that if the urine leaks into the prostatic urethra, it causes an intense reflex to micturate or mag-ihip, no? So this explains to you uh, the importance of having your prostate divided into lobes, no? So the median lobe actually hinders the complete voiding of the urine if it is enlarged. Okay? So for the bulbourethral gland, it's just a pea-sized gland. It produces a thick, clear mucus that cleanses the urethra of the acidic urine. It also serves as a lubricant during sexual intercourse. Important here is that the bulbourethral gland drains to the pineal urethra. No? It's not from the prostatic urethra because it's found inferior to it. Yan lang naman din. Okay, we now discussed the semen. It's a mixture of sperm as well as the secretions from the accessory gland. So the advantages of the accessory gland, as we've discussed earlier, the fructose will now serve as an energy for the sperm cell during its transport. And the alkalinity environment of the semen will now help neutralize the acidic environment of the vaginal wall to further have the fertilization of the ovum. And also the semen inhibits the bacterial multiplication and some elements of the secretion of the accessory gland would help in maturation of the sperm or the spermatozoa. Okay, for the testis, again, as I've said earlier, I won't get into very much detail of which because this is microscopic anatomy. Important lang for this slide is the tunica albuginea. Okay, as you can see, it's a dense fibrous membrane that sends an inward projection, and that projection would further divide the testis into lobes called your septally testis. Okay, but the next slide would be the most important portion of the testis line. No? Sige, if I may ask Dr. Ponce, what hormones this hormone is being secreted by your Sertoli cells? Anyone could answer from your microscopic anatomy or physiology? It starts with letter I. Anyone? Letter I, starting letter. No. Anyone?
Inhibin.
Okay, very good, Dr. Avilo. No? It's your inhibin. So take note that if I ask during the examination, what specific cell or this specific cell would give rise to the hormone inhibin? So the answer would be your Sertoli cell. Aside from which, your Leydig cell will now be responsible in secreting your testosterone, and the seminiferous tubules will give rise to the sperm. So ulitin natin, no? Sertoli cell is to inhibin, Leydig cell is to testosterone, seminiferous tubules is to sperm. So take note of this slide, no? Sertoli is to inhibin, Leydig cell is to testosterone, seminiferous tubule is for sperm cell. Okay, so take note. So I think I'm down to my last few slides. Okay, important lang for this one is that your epididymis, okay, this is a sagittal section of the testis as well as the epididymis. As it drains to become your epididymal duct, it is being continuous to your ductus or vas deferens, which will now be present within the spermatozoid. So yun lang naman yung importance of this slide. And take a picture of this one, and I'll be sending also to Dr. Ponce. I was not able to include it to the initial upload of your PowerPoint slide. So what would be the contents of the spermatozoid? I think this was discussed during the Gross A, contents yung sa abdominal cavity as well as yung sa inguinal canal. So important to take note that aside from your ductus or vas deferens, within the spermatozoid, there will also be arteries, veins, nerves, lymphatics, as well as a certain muscle called the cremasteric muscle. So take note of this slide. I'll be sending this one also to Dr. Ponce, kahit sa Telegram na lang. I could ask a question kasi for this one. So it's very important, and this will also further be discussed in your manuals. So take note. It's your ductus or vas deferens. It's not your ureter. It's not your ejaculatory duct. It's not your prostatic urethra. So it's kasi lahat sila may ducts. So don't get confused, no? I could ask during the examination. The following are contents of the spermatic cord, etc. Okay. So I think that wraps my lecture for this morning. The sources will be the Snell and as well as your netter. So if you have anything in mind or anything for clarification, just make use of your Snell and also supplement it with your netter. So use it side by side. Okay. So I think that's about it. Any questions from the class?